First, let's welcome Cindy Cheatham and Kimmie Durham of the Novant Health Brunswick Medical Center Foundation. Cindy and Kimmie, we are so glad to have you on the show today. Thanks for joining us.
We're glad to be here.
Thank you.
Before we really dive in, we of course want to make sure everybody knows who you are. So Cindy, why don't you go first? Tell me a little bit about your background and your role.
Okay. I'm the development manager with the foundation, Novant Health Brunswick Medical Center Foundation. I come with about 10 years of fundraising experience. So my role is really to raise money for the hospital, since we are a nonprofit hospital.
Very nice. And you said you've got several years in fundraising prior, correct?
Yes,
right?
yes, here in the community in Brunswick County. So I'm excited to share that knowledge and to take some of that skill set to raise some funds for the hospital.
Absolutely. How long have you been in the local area?
I've been in the area since 1996, but I'm not a local quite yet. But I've been here since '96, and I've been with Novant Health since 2017, so about 2.5 years.
Nice, very good, very good. Kimmie, tell me about yourself and your background a little bit.
Amy, I'm a retired nurse and picked this out as a place to want to retire to. So bought here 21 years ago, actually yesterday, and have been here full time for 10. Got active in the community prior to my full-time move here. I'm very passionate about volunteerism and what you can do in your local community to make things different and better. And so I was very ecstatic when Novant asked me to be on the foundation, and now I am chair of the foundation. So when Cindy asked me to do that in Shelburne, I was very pleased.
Very nice, very nice. Well, we're certainly grateful to you. When you said you've only been here full-time 10 years, I thought, man, it feels like you've been here a lot longer than that. Very invested in the community.
Yes, and that's how I feel too.
Yeah.
I feel like it's been a big part of my life.
Well, certainly a good place to live. Now, where did you move from?
I spent 30 years in Stone Mountain, Georgia, but I grew up in Ohio. So I kept making my way south when I went to college.
Nice. Warmer weather.
Absolutely. No more snow. No more snow.
Nice. And now close to the beach.
Yes.
So I think you just got to stay now. You
Absolutely.
found the right spot.
That's right. I feel like this is home, and I've met so many wonderful people. We have such a benevolent, giving community, and I know how much support we all give each other, and it's incredible.
So I know you mentioned that in your background, you're a nurse. You're also a breast cancer survivor,
Yes,
correct?
yes, I am, and I'm very passionate about that. I am a third-generation breast cancer survivor. I say my journey began in utero. My grandmother found her breast cancer in June of 1958 when my mother was pregnant with me.
Wow.
And she survived cobalt radiation, which is the old-timey stuff, because 1958 was a long time ago.
Thankfully, things have changed a little bit, right?
Yes. And she had the radical mastectomy, went through that, and she was a tough old bird because she lived 16 years post that and died of nothing related to the breast cancer. And then my mother had her cancer at age 52 and had the new, which was new in 1978, modified radical mastectomy. And then I came along at 38. That's when I got diagnosed.
Wow.
And because of my age and family history, I did have the lumpectomy. That was a choice, that or a mastectomy. I chose the lumpectomy, and then I followed up with radiation because that comes with a lumpectomy, so that they can make sure that they get all those cells. And then I had chemo. And so I'll celebrate 22 years of survivorship this year.
Congratulations.
Thank you.
Congratulations. So young to have such a serious diagnosis.
Yes, yes.
And amazing. I mean, we see you share your story all the time and really do a lot to support breast cancer in our community, which means a ton. I know, Cindy, that the foundation is doing a lot around breast cancer awareness. Can you tell us a little bit about that?
Right. Well, we have a breast health fund as part of one of the programs that the foundation has available. We apply for grants every year. We've received grants from Komen in the past, Pfizer in the past, and we have some of our communities that hold golf tournaments and give to that. We have an employee giving campaign, and the employees who are very passionate about that also donate to that. And it's just nice to have that fund available to those women who need those tests, who might not have insurance or who are underinsured.
You mentioned the Susan G. Komen,
Yes.
which I think most people are familiar. That's one of
Yes.
the foundations, and you just know that name.
Yes.
So tell us a little bit about the dollars, and I think we got a recent grant.
We
from-
got a recent, yes, we were awarded a recent grant, a little bit over $29,000. So that will do a tremendous, that would just be tremendous to help the women in our community. And we received a $10,000 grant from Pfizer. So that's just a lot. That just
Yeah,
helps
great
a
funds.
lot of women in our county.
So we're just talking about the Komen funds,
Yes.
the Breast Health Fund. How can women in our community access those resources?
Well, there's an application that they can complete through patient registration, and that will help determine the funds that are available to these women who are underinsured or uninsured.
Great.
So that would be the first step.
Perfect. And the hospital recently added a second mammo machine, correct?
We did.
Yes.
Great.
Yes,
Great.
I think it's a 3D machine, and that seems to be very much in
Standard of care.
demand
Yep.
these days, and rightfully so, because that's important for early detection.
Wonderful. Well, I know, Kimmie, you certainly, from talking with people in the community and your own experience, but what does this mean for patients when you talk to them about these funds being available?
It means so much, and I would also like to remind everyone that as a woman, and again, we have to remember 3% of all breast cancers are male. So if you have breasts, you're at risk. So remember that. But anyone who has found a lump or has something suspicious, they can go right into patient registration. You can sit there. Obviously, the appointments are good, but you can be seen. All that has to happen is you have to have a doctor's name to send the results to, and that is something that separates North Carolina from a lot of states. So you don't have to make a previous doctor's appointment and all that. You can go in and take care of
Just
yourself.
have the mammogram.
Yes, and then whether you qualify for funds or not, that can also be counseled, as Cindy said, through the patient registration process. The biggest thing that I'd like to leave with everyone is they have to advocate for themselves, because every case is different. And try not to be afraid if you find that lump, or if you find something suspicious, or you don't feel just right, and make sure you keep going and keep plugging away till you find someone in the medical community that's going to listen to you and make sure you get the test you need.
Yeah, that's such great advice, because you're right, as women, we can kind of write things off and be hesitant to pursue, but it's
That's right.
got to stay that path.
That's right.
Well, we may have some viewers watching who are interested in helping, that want to get involved, that want to donate. How can they do that, Cindy?
Well, they can contact me directly at 910-721-1745. And then they can also look on our website at supportnovant.org.
Perfect. Well, thank you so much for joining us today. Such great information and great work in the community.
Thank you for having us.
Thank you very much.